Well, friends, welcome to our Mental Health and Justice webinar hosted by the Journey Church and the Justice League of our church. My name is Chris, and I have the privilege of serving as one of our pastors. And I'm thankful that you are with us tonight as we try to seek and create space to think about significant topics around trauma and healing and mental health. I'm honored that I get to be on this call with two incredible people, Marcelle and Brittany. And I'll introduce Marcelle in a bit. But Brittany, would you introduce yourself and talk a little bit about the Justice League at the Journey Church?
Absolutely. Hello, everyone. My name is Brittany. I am part of the Justice League with Pastor Chris. It's a leadership group where we honor, recognize, acknowledge, celebrate people who are part of our faith community and our neighboring communities, particularly those that are marginalized, and it's just creating spaces of inclusion for those groups of people and letting them know that we see you, we recognize you, we hear you, and this is a safe and brave space for you.
I love that, Brittany. And thank you for helping lead that with us and being the impetus even behind this conversation. I wanted to name for anyone who is listening in or tuning in live, feel free at any moment to put a comment in the comment box. Whatever platform you're watching, I want to make sure that you feel like you can engage in this conversation this evening. Let me introduce to you our accomplished and well sought after speaker and facilitator and faculty member, Dr. Marcelle Giovannetti. I probably did not get that right. Did I get that right at all?
Did great.
So she is an assistant professor at Messiah University, teaching in the graduate counseling program. And starting in July, we'll be assuming a new role in July 1st as the Vice Provost of Student Success and Engagement, which we are thrilled to congratulate you and to celebrate this new role. And she also works part-time in her own practice called Courageous Hope Counseling, where she offers a service of counseling to people in this region. She presents locally, nationally at conferences. She is a educational trainer for the PA Certification Board. Marcelle earned both her doctoral degree in counseling education and supervision and her master's degree in clinical mental health counseling from Shippensburg University nearby. And she received her bachelor's degree in psychology from Elizabethtown as well. She has a postgraduate certificate in social justice from Harvard University, which I'm very curious about at some point to hear about Marcelle. And she was awarded the 2022-2023 Harry and Nancy Prius Outstanding Graduate Teaching Award at Messiah University. And her areas of counseling are wide and vast in substance use disorders, co-occurring disorders, trauma, and multicultural counseling as well. Marcelle is a certified drug and alcohol counselor, an approved clinical supervisor, a nationally certified counselor, a licensed professional counselor, and many more. And so she also serves as the vice president on board of directors for the PA Certification Board and is the chair of the ethics committee. And she is passionate around social justice, amen, working with marginalized groups and advocating for equitable access to education, treatment, and care. And so Marcelle, welcome to our webinar conversation this evening.
Thank you so much for that warm welcome. I really appreciate it. And I'm just excited to be here. And thank you for your church for hosting such an important conversation. I think it's really important that these conversations start in the church and that the church kind of carries the mission and message too. So thank you so much. I appreciate the invitation.
Of course. So let's just begin in this way as we think about mental health, as we think about justice. Maybe just to set the stage and maybe to help with some definitions and some clarity. And so how would you define things such as trauma and even mental health concerns? How would you begin to define that and maybe help us kind of foundation for our conversation tonight?
Sure. So, one of the things that I wanted to mention and kind of own also as part of my own intersecting identities, I'm an immigrant woman I grew up in India, came to the US in the 90s. So for me, when I talk about mental health and issues related to trauma, I'm always keenly aware of the cultural context in some of these conversations. So even when we talk about mental health means different things, and the understanding of that can either be very myopic and limited or kind of widespread, depending on the culture, the community, the environment that you were raised in. So when we talk about mental health, we talk about our what I mean by that is the psychological well-being. And with mental health, there are some diagnostic criteria. So there's a book actually called the DSM. It's our Diagnostic and Statistics Manual, is what DSM stands for. And this has all the diagnostic criteria in it. So it's an imperfect system because there are things that are missing from the DSM that I think are important, and we'll talk a little bit about that in a minute. But when you think about trauma or anxiety or depression or substance use disorders, there's actual criteria for these things. So just as you would go to a doctor or someone else for a diagnosis of something when you had an ailment, there are diagnostic criteria for psychological issues as well. And of course, trauma is one of them. So the one thing, you've probably all heard the phrase trauma informed. It's kind of like a buzz phrase. You've heard it in schools, maybe. You've heard it in workplaces, maybe post-COVID. Dare I say post-COVID? I don't know if we are actually, because COVID's still around and we're just able to treat it a little bit better now than we were a few years ago. So as part of all of that, I think, understanding what trauma is. So the one thing I wanted to say about trauma is that is not a one size fits all. So you and I, for example, Pastor Chris, could be in a car accident together, and we both might experience that very, very differently. And we both might be shaken up, and within a couple of weeks or months, you might be, a couple of weeks, you might be fine and have put it in a place where it's no longer impacting your daily functioning. Whereas for me, my response to that might be very, very different than yours. And that might linger for months and might have nightmares. It might prevent me from actually ever getting in a car again. So there is no one size fits all. What is traumatic to one person isn't necessarily traumatic to the other person, even though they might have experienced the same event even together sometimes. So I think that's an important piece to understand. And when we're talking specifically about trauma, we're talking about a person's response to a stressful event in their life. So, and that could cause them a lot of stress. So we would call that the traumatic event. And in trauma work, we have what we call the little t traumas and then the big T traumas, right? Which how much room does the trauma actually take up in your life? How much space? How traumatic is it for you? And so the things that define trauma are this sense of horror, helplessness, and where you're facing serious injury, or if there's a threat of serious injury or death or dying. So it's not just the individual that experiences trauma, it's also people like first responders, counselors, rescue workers, the COVID crisis, a lot of healthcare workers, experienced trauma from what they were seeing and exposed to with death and dying, right? So it's not just the individual, but there's a form of maybe vicarious trauma or secondary trauma that folks closest to the person who experienced the event can also feel some residual effects of that trauma as well. So that's a little bit about, I know we specifically talked about trauma and being trauma informed. So that's a little bit about, what trauma is. And I would add that there's 4 types of trauma that are most commonly kind of paid attention to. So the one is acute trauma. So that's more like single incident. And then there's chronic trauma. So that's more prolonged over a period of time. So situations where there's intimate partner violence, domestic violence, things like that, that would be considered chronic trauma. And then complex trauma. So this is the everything, everywhere, and all at once. So when you experience a lot of things all at the same time. So for example, the people in Ukraine right now are experiencing a war. They're experiencing violence. They're experiencing a lack of community resources, threat of safety for their own lives and their children, some abuse and neglect, also interpersonal issues that they're caught in the middle of with nations kind of warring. So a lot of the poverty, right? A lot of lack of resources, electricity, basic needs. So this would be the complex trauma, the everything, multiple things happening, varied multiple levels of traumatic experiences all at the same time. And the other type of trauma is the secondary or vicarious trauma, which I mentioned before. That's not just you, but what you're experiencing, but what people around you. So an example I always give with this is, for example, 9/11. It wasn't just the people that were there that experienced it. Of course, they experienced the event in a very profound way, but people watching other people kind of jump out of buildings and seeing the buildings collapse were also traumatized to some degree with watching some of that secondary or vicarious trauma, or experiencing some of that secondary or vicarious trauma watching the traumatic event unfold. So yeah, I don't know if that's helpful in like a basic overview of kind of what we're talking about here today. So when we say mental health, that's a broad umbrella. It could mean a lot of different things. And when we are talking about trauma, those are some of the things that we're talking about. And there are some things that are kind of justice issues that are missing from the Diagnostic and Statistic Manual. So we can get into that whenever you'd like. Mm-hmm.
Yes, and I would like to actually jump into that right now. So can you, Marcelle, help us understand how issues of injustice are related to trauma?
Yeah, absolutely. So I think, issues of injustice are actually related to health and wellness, overall, like in general. So I would say it's a broader conversation in terms of our health and well-being. There's a great documentary that was made in 2008, and it's several years since it came out. It's called Unnatural Causes. If you ever get a chance to watch it, I'd highly recommend it. It's got different parts to it. I think the full name of it is, let me see. I had it written down here because I know I was going to talk about it. Unnatural Causes is Inequity Making Us Sick is the full name of it. And, one of the things about our health and our wellness is that there's a socioeconomic factor in the United States to health and wellness. The richer you are, the more you have access to, right? And the more you can get access to. So who lives and who dies and the quality of life is very much in the United States dependent on socioeconomics, right? So when you think about a justice issue, does everyone have the right to health care? Does everyone have the right to access to care? Does everyone have the right to qualified professionals providing that care? And what we're seeing is, while we might say healthcare is a human right, there are a lot of people that are underinsured and uninsured, right, in the United States and our communities. And so I think more specifically, issues related to injustice in healthcare are access and availability, right? So can I access the services that I need when I need them, like when I'm actually in distress, versus how long do I have to wait to see a counselor, a psychiatrist, someone to help me with my mental health concerns? How easy or difficult is it to get an evaluation? What is my copay or deductible, right? So these issues of access and cost are very much a justice issue, in my opinion. And then when it comes to trauma, so, I went through that long list of the different types of trauma. And what you'll notice is racial trauma wasn't on there, right? So for years, there has been a lot of pushback from the psychological community to say, well, how do we deal with racism and racial trauma, right? And why isn't that something that we have a diagnostic criteria for, a code for? And, oftentimes the argument is, well, you can relate something to an event that occurred and say, okay, these are the symptoms and these symptoms have hung around for this amount of time. But, how do you measure racism over an entire history, right? Over a country's history, over a lifetime? It's like a million different paper cuts, like coming from every direction. And so how do you measure that, and how do you create diagnostic criteria? Yet it is I don't think anyone I've ever talked to has said, oh, well, racial trauma doesn't exist. How could we not say it doesn't exist, right? There's plenty of evidence that it does. But when you think about a justice issue, if someone has experienced historically in this nation, the Black community has experienced so much hate and terrorization, really, right? 9/11 wasn't our first terror attack. There'd been plenty of other terror attacks on U.S. soil before then. And so when you think about that over a lifetime, and then you watch something like the George Floyd incident or Breonna Taylor kind of unfolding, right? So you're triggered. There's a historical piece of that generational trauma. And then you're also incredibly triggered because you're seeing yourself also in that story. And then you go in to get help, and they're like, okay, well, what are you here for, right? Well, the racism in my community, what can we bill for, right, under this diagnostic code? What can we say? So to me, that's a justice issue, right? When you have things that are completely absent, that affect a large part of our community and society, when things are completely absent, and not like given the importance and consideration they need to be centered around. And then other issues related to trauma, I would say, so the LGBTQIA plus community, right? When you think about trauma and their experiences and access to competent care, multiculturally competent care, and their access to resources that are kind of empowering and affirming versus kind of further wounding and hurtful. So in the United States, conversion therapy, the American Counseling Association has taken a stance and said, this is unethical, but not every state has banned it. Any of you know when Pennsylvania decided to ban conversion therapy?
No.
August of 22.
What was that day? August of when?
August of 22.
Wow, that's interesting. Wow. I thought it. Wow, so it recently was banned.
Recently, right? Recently, very recently, not even a year, right? So that's Pennsylvania. There are still some other states in the United States that have not banned it, right? And so when you think about justice issues related to trauma and inflicting more wounds on an already vulnerable person coming in for help with all kinds of things, right? Depression, anxiety. The other, piece of competence is sometimes folks in a gay relationship, right? Not a heteronormative relationship. They don't get screened for the same things like intimate partner violence, right? With the same frequency. They don't get asked the same questions, the same level of kind of care and protectiveness. Of how is your relationship, are you experiencing any forms of abuse, control, those types of things. Those questions aren't asked in the same level of competent care, I think, sometimes. And so for me, that's another, justice issue in terms of being able to value the dignity of every human being and offer the same type of care, empathy, and service to everyone, right? Regardless of your own beliefs or values or whatever else you may hold true. So it's like treating everyone with dignity and respect and equitably. So those are, a few that kind of come to mind when we talk about, justice issues related to kind of mental health. I think the big one that's paid most attention to sometimes is, socioeconomics and how do people have access. But these are some other ones that are, incredibly important that maybe sometimes don't always get the same attention, I would say. And then when you think about even our churches, like in the local community, and how churches respond to people and injustices that are actually created by the church against people. What if your trauma was linked to your experience in a faith community? So this could be sexual assault. This could be gaslighting and manipulative behavior. This could be giving faithfully and tithing to a community only to discover that money was kind of embezzled, or, funds misrepresented, or whatever that may. So these are all kind of sources of wounds that people can carry. Assuming that the church is the safe space is not always a good assumption or an accurate one when it comes to what people have actually experienced.
Well, there's so much there. So just even just initially, the initial injustice that I appreciated you naming was just the question around access and cost, which just that question in itself it transcends color lines, transcends where one lives, right? That kind of question is just fundamental to kind of our society, the access and cost of that, right? So I appreciate you naming that, and then just the nuance of that around, which I think we'll probably get a little bit deeper around LGBTQIA, to the harm of the church. But just the question I was wondering in my head as you were naming all of that is just the language of competent care, and that's just this interesting thing. Like, I've never thought about asking this, so I'm going to ask this, Marcelle. Like, that's interesting. I think about pastors. There are effective pastors and ineffective pastors, right? I never really thought about that in counseling, right? The thinking about that there are competent caregivers and not. And so how would you just talk, when you think about competent care, particularly in the nuance around justice and injustice, like how do you define competent care, and what should we be aware of, right? Or what kind of questions we ask so that we know that we're actually getting multicultural competent care or inclusive competent care? Like, just maybe expand on competent care. It's a language I've not thought about before. So if you could help me with that.
Sure. So, I'll start by, as an educator in a counseling program, I'll start by saying, our ethical code as counselors kind of mandates that we are multiculturally competent. But as you kind of just named, that doesn't necessarily mean that everybody is, much like, ethical code of the medical practices, like to do no harm. That doesn't mean that doctors always do no harm, that type of thing. So, counselors, as part of their training, are required to meet multicultural competencies, right? But there are folks that, while they're under supervision, they can have some guidance. They can have, folks that are coming alongside of them and helping them learn about cultural competency, because it's also about learning as well. Not everyone's competent. I had to learn, and I'm still learning, how to be more competent in the care that I offer. Because the world is evolving and changing as well, right? And so even what we know today about mental health might be drastically different, 50 years from now or 10 years from now. So I would say multicultural, when you're looking for a competent care, a few things, the types of questions that a person asks, can often give little clues. So oftentimes I'll hear things from the clients who identify as part of the gay community, who might say things like, you know what, when you ask me what pronouns you would like me to use, well, that lets me know, right, that you are competent, that you were thoughtful enough to ask that question, right? If it's on your forms and in the language, you can tell that there's competence, right there. In some of the way the questions are framed or asked, you can either tell if there's inclusivity or not. So even before you even meet your therapist, the type of forms that you get to fill out can give little clues. It's kind of like when you go to a doctor's office and they ask you to check certain boxes. As an immigrant woman from India, the only box that I've ever been able to check on a form is Asian. And then it's so interesting to me. And Asia is a continent, a pretty big continent with lots of very different countries in there. That will clue me into the competence. And then the way the staff respond to me as they're looking over the form and either responding with a very puzzled, like, because they are not expecting, or they don't consider someone from India an Asian, right? Even though I had to actually explain this. This is a real life example. I actually had to explain this to someone in a doctor's office one time when I went in. So, those are little clues. But I just want everyone listening to know that ethically, your counselors or professionals that you see are required by their code of ethics to be multiculturally competent. And so if you find that they're not, I think it warrants a conversation. And of course, you don't ever have to put up with any form of like abuse or prejudice, or any of the isms, right? When you're going for care. I think I say this to my own clients as well. If for whatever reason I'm not able to meet your needs, or things aren't, clicking, between us, counselors are kind of like shoes. They don't all fit the same. You have to find what's comfortable for you. I always say to them, please let me know and I'll help you find someone else, because, you're investing your time, effort, energy, money, and it takes a lot to be vulnerable and open up. So you want to be able to get the best care possible. I think that's why people often feel safer when they ask trusted sources for referrals versus maybe going to their healthcare portal online and finding a provider, right? Because you can see the long list of, letters after their name or their credentials, but you don't know how they're going to present and receive you and how inclusive they're going to be till you actually, have a conversation with them.
So Marcelle, you spoke about how far we've come in understanding mental health. But one of the justice issues I think that still relates to mental health is the stigma around mental health. So how are we able to silence the shame when it comes to the stigma of mental health?
Yeah, and I think this is, honestly, I think some of the stigma can be perpetuated within, the church as well, right? So I can't tell you how many times I've had clients say to me, I was told not to come to counseling. I was told by my faith community or church community that, all I need to do is pray harder and go to church more often. And somehow, because I wasn't doing something enough, right? And that's why this continues to be a problem in my life, right? I've had folks say, my faith community told me to stop taking my medication and that I should really just fully rely on God and trust God, right? I've actually have pastors give their congregation members, sorry, Pastor Chris, not you at all, right? But
it's all right. Yeah.
I've actually had that conversation with, with things like depression, anxiety, you don't need that medication, those types of conversations. And I think, also when it comes to, so that's kind of perpetuating stigma, those types of comments, not acknowledging that, there are different paths to freedom and that healing, and that mental health, is just like physical health, when you would go to a professional, and it's a tool. The medical expertise is a tool that we have available to us through our actual privilege of having access to it in the country that we're in, because there are other countries where folks don't even have access to some of the things we do medically. So I think there is a lot of stigma. I think sometimes it does tend to get perpetuated in the church. And so this creates this feeling of guilt and shame. Well, I can't go access because maybe I'm not a good enough Christian. Maybe I didn't, I'm not living my faith out enough. Or, sometimes even there's this belief like maybe I'm displeasing God in some way. So, I'm being punished for something, right? And so there is a lot of stigma. And I think in some ways, what I've noticed is it has become a little bit more normalized, particularly in the younger generations, I think. I've definitely seen, for example, more college students talk more freely about mental health, or, come in to different environments, or even in their places of employment, and disclose, hey, I can't be at work at this day at this time because I have a standing medical appointment, like, with my counselor. So I think there is a little bit more openness, at least more today than I've seen in the past. But I think we still have a long way to go, particularly as faith communities, right, to do our part in destigmatizing mental health and kind of normalizing things. In some ways, I think folks got to experience with COVID how everything got exacerbated with mental health because of isolation and separation from communities and all the positive coping things that we did, whether it was exercise or fellowship or just gather together to share. And so I think folks started to have a little bit more empathy, right, when they experienced some of this distress themselves. And I think that shifted maybe some of the conversation around mental health in the church, particularly, I think. So, and I'm not trying at all to say that the church is the only place that stigmatizes mental health. I hope that's not coming across at all. But I just wanted to give examples of how that might happen within a faith community.
I do have a follow-up question for you. I'm not sure if you've ever heard of the term toxic positivity. And it speaks to how we try to downplay issues by just thinking positive, speaking positive, vibes only, right? Like the FROG acronym, fully rely on God.
Yeah.
How do you think that has played a role in hurting rather than helping when it comes to mental illness and dealing with issues of trauma and injustice?
Yeah. So, the look on the bright side philosophy, right? That everything, everything is awesome, that kind of mantra. I think one of the most healing things that a person can do for someone else that they care about is to make them feel fully seen and heard, and to also just be a person that's willing to sit in the pain, right, with them. So oftentimes when I'm doing seminars or speaking to groups, they often will say things like, well, how can I help? I just want to help. This person is really struggling and I just want to help. And they're very sincere in that, right? But you can also, having an intent to help is not enough, right? You can actually want to help very, very badly and think that what you're doing is going to be helpful. And it can actually have the opposite effect. It can actually be damaging to the individual as well. So, I often will say, imagine if you were dealing with the worst thing you've ever dealt with in your whole life, and it just wrecked your whole world. And someone came up to you and said, it's okay. It's going to be all right. It's going to be fine. You're going to get through this. Look what God's teaching you through all this. I mean, in that moment, you'd really want to slap them, right? In that particular moment, you'd feel some kind of way about hearing that, because in some ways that's very dismissive. It's very minimizing of your pain and your experience. So it's not that those things maybe can't be true, that God won't use that pain and turn it into purpose one day. But, hold on a minute. It's all just hitting this person in a second. And so, empathy, empathy first, leading with care and compassion first, as opposed to fixing. And I think oftentimes folks want to fix right away, and they feel helpless and powerless when they can't fix. But imagine how the person experiencing it feels, right? That helplessness and powerlessness is part of their traumatic experience. And so trying to fix it for them, because, honestly, you can't, that's the thing. And, one of my favorite quotes to use is, there's only one way through pain, and that's through it. You can't go like around it or under it. Like, you go through it and you walk with trusted people through it. And that's part of the healing process and journey. And that's actually kind of a Jesus model, right? In my opinion, as well. So better that than trying to kind of fix, right? But I agree, this level of toxic positivity, or just saying that everything's going to be great, look on the bright side, not allowing a person to just experience what they're going through and just be there with them and listen. And I do have some tips that I think I'll share. This seems like a good moment to bring it up. about, how do you help someone who is feeling like they've gone through a traumatic experience and they're suffering, and you do want to help, but what are some do's and don'ts, I guess I would say. So, first thing is to just recognize and acknowledge, just allow them to speak freely and openly, and recognize and acknowledge what they're going through. So even if it's, just saying something like, my goodness, I can't even imagine, that must be so painful or so difficult for you, and just validating that what they're feeling is normal. They have a right to feel what they're feeling. It's okay that their responses might be different than what someone else, responded in that same situation. So being able to feel seen and heard and acknowledged in your pain is very, very important. Also, thanking the person for trusting you. If someone has opened up in a vulnerable way and trusted you with something, it's very important that you acknowledge that they have shown trust in you by doing that, and because you might have been the only person they trusted, you might have been the first person they ever told. The other thing that we kind of say is, especially if you're a teenager and you're in school and maybe, a friend has said something to you, we always say, don't make this devil's pact and say, you can tell me anything and I'll never share it with anyone, right? Because the goal is to help the person. And sometimes help means that you have to activate a level of care around them, especially if it's, concerning issues of safety. So, and of course, in our current world, there are folks who are like mandatory reporters and mandated reporters. So you can never really truly promise like, hey, tell me everything and I won't tell anyone. So it's kind of also knowing those parameters of listening, so you don't inadvertently make a promise that you can't really keep, because that will erode trust, right? And that will make it less likely that that person will go out and ask for help again. So I think it's important to recognize that you do have a chance to play a critical or crucial role in a person's life when they've been through something traumatic. So being patient and understanding, healing from a traumatic experience takes a lot of time. So just be patient. If it's a loved one, they might be more irritable. They might have trouble focusing. They might have difficulty getting out of bed or completing tasks, right? So it's important to not judge and to just be patient and understanding that they're going through a process and that there is no time limit, right? There's no, oh, I thought you'd be better by now, right? It's been weeks, it's been months, why aren't you? So that there's a level of patience. And then just practical support. Sometimes people neglect the practical things that they can do. They want to fix the big thing, but then they forget about the practical things. So can you help this person with some, cultivate a normal routine in some way? So can you buy groceries for them or collect their groceries or make them meals or, do housework or, watch their kids or just be available to talk or listen or send, little texts or encouraging notes saying, hey, just thinking of you and praying for you, today. If you want to talk, feel free to call. If not, I totally understand. So there shouldn't be pressure that I care about you, so now I want you to receive that care and acknowledge that I'm caring for you and trying to help you. So just allowing the person to go through it at their pace, and not really pressuring them to talk. Not talking sometimes can be a way of self-preservation. Oftentimes the person is trying to avoid being re-triggered, by talking about it all the time. Sometimes they're just exhausted. So especially in cases with an assault or abuse, they've given a police report, they've talked to other people, they've talked about it so much, there's a level of kind of numbness. If any of you have ever had a family member who's been sick with a large community, you know what it's like to have to repeat that information over and over again and how old that can get. So the same is true for traumatic experiences. Not everyone has to talk about it all the time to everyone in order to heal, right? And it's important to acknowledge that control is very important in the healing process and allowing the other person kind of come to you and you be available, but not to kind of impose and say like, well, I'm here for you. I think you need to talk about it. And I think you need to talk to me about it right now. Right. So not forcing someone to open up, but just letting them know that you're there to listen and available, or even just you can hang out and not talk about it. Sometimes that's very healing, right? To just say, hey, let's get together and let's like not even mention it, so you get a little bit of a break and just you have something else to focus on, right? Let's go play tennis or whatever else, get your mind off of it, or let's go see a movie, and we won't talk about it. And I can be that friend for you that's supportive in that way. And I think the other piece is to help them get back to, sometimes it's hard to socialize and relax after you've experienced something very difficult or painful or traumatic. So just even helping them, go out to dinner one-on-one, or, maybe just a few trusted friends get together and, just have a low-key evening, so helping them get back into that pattern of socialization very slowly and conscientiously and thoughtfully. That could be another way to help and support. It could even be like, hey, let's do this fitness class together, or let's take a few yoga classes together, or let's go on this kind of trip somewhere. But just those small little things that can help a person socialize. And I think the other piece is to learn not to take things personally. So the person is responding to you in this way, not because they, don't think you care about them or you're annoyed or irritated with you. They're just learning how to cope with something, and it's, difficult and painful, and they don't necessarily know how. So if they're more irritable or if they shut you out, like try not to take all those things personally or blame, but just rather just acknowledge that, they're going through a healing process, or maybe they haven't even begun to think about healing because they're still in their wounds, right? And so lots of grace and care, and not taking things too personally. And with children, trauma can look a little different. Oftentimes it can look like behavioral issues in class, or fighting with friends, or things that you might not have seen before. And so being able to kind of recognize that sometimes when someone's behavior seems to be a little bit more erratic, maybe there's something deeper going on. Right? It's not just because they're going through a phase or acting out. There might actually be some underlying stuff that's causing that. And they might start struggling in school because of that. And it's not because they don't care, they've stopped caring. There might have actually been something that happened, but they can't name that.
I'm sorry. Go ahead, Pastor Chris.
You're so kind. Let me. What I really appreciate about all of that, actually, Marcelle, that I maybe just wanted to capture for a moment was, how do we help kind of normalize that, even as one person who's watching, that chemical imbalances are real, that people experience trauma, that there are days that they don't have positivity just because of a current trauma experience from the past, or whatever. So kind of normalizing that in the world, but also the church, right? And so I do lament in the way in which the church has failed. Something we've said before at the journey, but I feel like I should say it again. That it's actually we need a counselor and we need Jesus. We know we need Jesus and a therapist, and both are really important, and a therapist is exceptionally important. And so some of these helpful kind of ways in which we can respond. So maybe this is the question I have: is what's the tension between being someone's friend or church member versus recognizing that someone they need the support of a therapist or a counselor, right? My assumption is there's a fine line there, right? For me as a pastor, I'm very quick to not offer continual trauma care, recognizing that is not my training. I can meet with someone once or twice, but we'll always refer them on for the most appropriate training. So how do we make sure we're really good friends or partners or partners? We'll also recognize that sometimes we just really need to support them to find the right treatment and support, because it might be a bit more than we can navigate. So what's that tension in this?
Yeah, I think, that's such a great question, because a lot of times that line gets so blurred for folks, and the kind of when is the right time. And so what I always say is, sometimes it's not even your job to do that assessment piece, right? Because why is it up to you, right, to know the untrained person, right? Why is it up to you to know when that crisis, how close to the edge of crisis that person is? So sometimes, if you're not sure, but you are seeing a person struggle, right? You're seeing a person struggle. Counseling isn't just for the times like, you're kind of already fallen off the cliff or in the pit, right? It can also be preventative in a lot of ways to say like, okay, I've had this experience, right? I want to make sure this experience doesn't turn into kind of PTSD, which is, longer term. I'm still affected by this, 6 months from now, a year from now, I'm having trouble sleeping. I can't go to work. I'm scared, So I think sometimes even just saying, have you thought about talking to a counselor? Like, here are some resources, and just acknowledging that place of like, I can be your friend, but I'm not a professional yet. And sometimes even sharing if you've had your own experience of, working with a counselor through something and found it helpful, even just sharing that as a word of encouragement to say, hey, you don't have to walk through this alone, and I can be your friend through this, or I can be your pastor through this. But maybe, you might also benefit, because it's not either or, it's not one or the other, it's a community of care. And so I think part of that, community of care is saying there are lots of different avenues for support. The more of them that you are able to access and utilize, right, the more helpful that process might be to you in being able to get back to a level of functioning that's optimal for you, right? So, because sometimes the longer you wait, right, the more stuff starts to kind of come out later on down the road. So, for example, we know that with adverse childhood experiences, right, childhood trauma that a person has, it can affect them much longer, in different ways, much later in life. So there's a lot of focus on, well, how do we have trauma-informed schools, and how do we train professionals to work with children so that it doesn't turn into trust issues in relationships for the rest of your life, or perfectionism, or it doesn't change. Turn into attachment problems that you might have for the rest of your life. So I think that community of support, and that even just taking a step back and saying, I don't need to assess the severity. It's not my job. I can simply recommend the support and say, hey, here are all the avenues available to you. If you want me to drive you to a session, come with you, wait in the waiting room, these are all things I could do. But my role in this is your friend, right? And I think sometimes it's also important as a friend to ask the other person what it is that they need from you. I think this is another kind of missing piece or step. Sometimes folks just assume, oh, well, this person just shared this with me, so clearly they want me to fix it. No, sometimes they just want you to listen and hear them and not do anything. Sometimes they might seek your advice or want your input, but don't offer it unless you know that. So maybe even just saying, so let me know what you want from me in this role as your friend. Do you want to use me as a sounding board in decisions you're making? Do you want me to just listen and be supportive to you? Are you coming to me looking for counsel or guidance around something or an issue, or want my perspective on something? So I think that's an important piece, to include the other person and ask them what form of support they're looking for, because some more support can be different things to different people.
So in servant leadership roles, especially when we have them in places like the church, we can care so much for others that we can neglect our own needs and ourselves and the need for self-care. And it's much more easier to pray for others than sometimes to pray for ourselves and to think about our own things that we're going through. How can we kind of hold the mirror up to ourselves and recognize the issues that we're going through, that we have, and what can we do to kind of feed into that self-care and self-love that so oftentimes we neglect, especially when we're in these roles?
Yeah, I love that. One of my favorite quotes is, if your compassion doesn't include yourself, then it is incomplete, right? And you've also probably heard the phrase, well, you can't pour from an empty cup, right? So in order for that pouring out to kind of occur, I think it's really, really important to monitor. So, I often will say to folks, just like when you're sick and the doctor's like, hey, you just had surgery or something, take your temperature to make sure, it's not, you have to have a measure, right, of something that says, hey, now is time to act because, my temperature is not normal. So you have to have a scale of which to measure kind of the baseline of your wellness. And so part of that is, creating a culture of kind of accountability and helpfulness in saying, not only holding each other accountable, but holding yourself accountable. So what are the dimensions of your own wellness that have been struggling? Sometimes it's your spiritual life, right? Sometimes it's your physical wellness. Sometimes it's your emotional and mental wellness, right? And so it could be, sometimes it's actually the food you consume and what you put in your body and whether or not you're sleeping, eating, the basics, right, as part of your wellness. So I think monitoring that, oftentimes, with graduate counseling students, I'll give them something called the ProQual, which is professional quality of life. It's like an inventory, and it helps you kind of assess what areas. It's like a little survey you give yourself periodically to kind of assess, well, how am I doing in these areas, right? I need to be aware, because you can't really change something that you're not aware of. So you want to increase your awareness in terms of what areas are deficient. But I think it is also part of a faith community. It's our job to help recognize burnout in each other as well. Oftentimes it's your family who will recognize it first, before, or the people closest to you. And sometimes it's hard to recognize. And I think also reframing some of these messages that the church has been perpetuating that are really unhealthy. Jesus himself, who was God in the flesh, took breaks and went away and didn't heal everyone that came to be healed and in his path. You know what I mean? I often will think about that. Like, what about all the people who didn't get healed, right? What about all the people who came and waited and were there for a long time and traveled, and because you didn't have cell phones and GPS didn't know where he was going to be, and we were waiting in the wrong town, and never got to get healed, even though they believed, right, and came faithfully. And what about the people that were waiting when he was on the boat, and what about the folks that he actually left for a while, right, like his disciples, and went into the desert? So when you think about these examples in the Bible of Jesus really taking a break and communing with the Father, there's lots of them. But somehow we've gotten this message of, unless you're always perpetually giving all the time, you're not Christ-like. And I think there's a different way that Jesus modeled of what it meant to be in communion with the Father, right? So that you could live out calling faithfully, right, in a way that was God-honoring. Yeah, so I don't know if I answered your question, quite thoroughly, but those are just some of my thoughts on self-care. And as a community of faith, how can we hold each other accountable to that care, or help each other press pause when we need to, and do the things that fill us up? So even just Sabbath and rest, and truly being able to encourage each other in that, right, versus the frantic activity of ongoing things.
So I wonder, as we're kind of trying to normalize care for ourselves and normalize the need to be honest with how we're doing, and creating cultures and communities where that's affirmed, and there's less stigma around it. So I wonder, what does that look like for people or faith communities? But I'll say for people, when we think about our LGBTQIA community, our minority communities, our immigrant communities, even women, thinking about kind of some of just the gender dynamics that are at play. Like, maybe the question is, like, how can we best support persons who have been historically marginalized in our society, that has in fact affected their overall health and emotional. And so would you have words as someone who actively works to help bring healing to people? How can we create communities and be people of healing, particularly to those who've been historically marginalized in our society?
Yeah, I think that's a great question. And I think, the conversation starts with acknowledgement, right? And so when there's an acknowledgement, a recognition of that historical trauma, right? That piece that you mentioned, or when there's just a naming of injustices, I mean, that can make a person feel so seen and heard when you can just name some things, right? It might sound overly simplistic, but I mean, the power in just being able to name something, because that means you see an aspect of the person that they feel like the rest of the world is ignoring, right? So when you can actually name something, name the injustice, talk about it, name it openly, and make a commitment, right? So kind of justice in action, making a commitment. So not just like naming it, but I think it does take it a step further. So for example, it's one thing to say, okay, we don't have access to people don't have access to resources, and there's a socioeconomic link to access to treatment and care. It's a whole nother things for a church to wrap their arms around that issue and try to help folks get access to care, or network with counselors who provide pro bono services, or some churches have started to have their own counseling, agencies, or pay for services. So I think sometimes, like in action, that looks like the small tangible things. So another example I often give is, churches are great at providing meals when someone has had surgery, when there's a death, and when they're babies, right? Those are the meal train is moving on those three things for sure, right? If you had a baby, if you had a death, or if you had some medical thing. But what about for families who spent all day in the courthouse because their kid got a DUI, right? What about, someone who just had a hate crime committed, or just had, someone call them some racial slurs, or got fired from a job because of some unjust practices, right? Or got denied something, that they should have had access to simply because they identified as being gay, right? So what about meals for those types of things, right? What about meals for the folks that went to jail that weekend, right? Because, they had a substance use disorder, right? So I think, those other pieces of how do we care, and for what things do we care, for what do we show up for each other for, with visitations, with meals, with hospital visits. I mean, is the same level of care and support available to all things, or just some things, right? And I think that's a tangible thing that's reconciliation in action, right? That's kind of living out all right, here's some historical oppression, systemic stuff. Well, what is being a balm in that situation? A soothing ointment. What does that look like? And do we see all issues equitably, I guess, is what I would say. Yeah. So I don't know. I feel like I rambled a little bit on that one.
No, I thank you.
Actually, did you hear that?
I heard it.
Yes.
Yeah. You just expand even the meal train. I just appreciate it. Just like, just the expanding of, because one is mercy, right? Just like and one is justice in action, right? That's how I was just I was thinking that. And so, wow, thanks for just pushing up against that a little bit. And thinking about the fullness of that. I don't know if you have a question that you want to ask Brittany.
I do. I actually just want to just take out one of the pieces that you mentioned. So you did kind of touch on substance abuse disorder. And we know that that coupled with mental health issues, a co-occurring disorder. So can you speak to how that effect can show up in someone, and how can we show up for a person who's experiencing a co-occurring disorder?
Yeah, so a lot of times there's a lot of myth. So we talked about stigma, right? And so for 8 years of my career, I worked as a drug and alcohol counselor. And I know you have some experience with this as well,
Yes.
Brittany. So feel free to chime in as well. But there's a lot of stigma with this population, right? Just like there's a lot of stigma with any addictive process, whether that's like gambling or pornography or sexual addiction or substance use. There's a lot more stigma, guilt, shame, and the belief in, well, you're choosing that, right? You're choosing that. This is not the same as if you had gotten cancer or heart disease or diabetes, right? And so I think there's some work to do around this idea of choice, and what might start off as choice and experimentation kind of crosses over into more of a brain change in a person, where really what addiction is impaired choice, right? It is the inability to make good choices because there's a part of your brain, your prefrontal cortex, that's really affected, and your decision-making process is affected, right? So it just kind of looks like you're making bad choices and this is all bad behavior, right? Now, when you kind of scaffold that on top of depression, anxiety, the reason people, or any other schizophrenia, any other psychological disorder, a lot of times it's a way to cope, right? So if I have, say I'm a veteran, and say I experienced some of the horrors of being, placed in a very violent situation, and I can't sleep at night, and I'm very agitated, and I'm very startled, and I can't focus, and I can't concentrate, and I can't keep a job, and I have outbursts. And the only thing that helps me sleep is alcohol, because then it helps me pass out and numb, right? That becomes a way to cope with the thing that I'm having trouble living with, right? Same with anxiety, same with depression. So sometimes folks turn to things that are maybe unhealthy and can actually make the problem exacerbated or worse, because they're just trying to find a way to cope, right? They're just trying to find a way to cope. And so being able to kind of understand the underlying situation, right? I actually first became interested in trauma work, and that became a focus of my learning and an area of expertise, because I worked in substance use disorders, and I was seeing a lot of trauma. And so those things kind of go hand in hand. They're co-occurring. They occur together a lot of times. Doesn't mean one causes the other. So we're not saying causality. We're just saying those two things tend to appear together, quite a bit. And so I think part of that is just saying you have to be able, you can't just, if you say to someone, stop drinking or stop using marijuana or stop smoking or stop, using cocaine or heroin or opioids or whatever, and you haven't addressed the trauma, right? Like it's a losing battle, so to speak, right? We're talking about holistic care and being able to provide the person with the type of support that is needed. So, again, refraining from judgment, understanding that you might not know all the pieces or the whole story of a person's life, because they might not have trusted you with all of it. But really the goal is to get a person as much care as they can in the right areas. And there's some systemic pieces, right, to access to care. So in the state of Pennsylvania, for example, they have separated the treatment of drug and alcohol and mental health. So this means that you have to go to a different licensed mental health provider, and then you have to go to a different person for your drug and alcohol, even though those things might be correlated, interrelated. And so think about that's extra time, money, effort. You have to find providers in your geographical area. So there's a lot of systemic pieces that are kind of not set up towards a lens of justice, and serving. But, again, if you're financially well resourced, you don't have to work, you have unlimited resources, easier to get help and access to things, right? So I would say kind of understanding that it's not all or nothing, it's not one or the other. You can't just treat one without the other, and understanding that there might be a lot of deeper issues, right? A lot of deeper issues, oftentimes linked to traumatic experiences, that are kind of the undercurrent of what you might be seeing on the surface.
Thank you. You touched on that beautifully. Oh, sorry.
So,
Go ahead.
no. I'm actually appreciating this conversation. Just thinking about, persons that we all know who might be navigating this. The language you said just began to respond was just the language around like brain change.
Mm-hmm.
And so talk about like the choice and then brain change and then we kind of lead to impaired kind of decision making. Talk to me a little bit about brain change and how the various substances really begin to change. I don't know if I'm just fascinated if you want to unpack that a little bit.
Yeah. So one of the things I want to say is, there's also, I want to acknowledge there's different schools of thought around like the addictive process, right? There's tons of research out there, so, I mean, the most common would be, hey, this is a choice and you can make good choices and bad choices. So if you put in an environment where you're forced to make good choices, that's kind of all you'll do, right? And folks have used the argument like, well, not, when you're in the hospital and you're on some pretty severe painkillers for surgeries, not everyone gets addicted, because you're in that environment, you take it, you're taking it in large doses, and then you're discharged, and, not everyone gets addicted, and so understanding the brain is very complex. And I think it's only in the recent history that we've actually even begun to study the brain, and we still don't know everything there is about it. But what we do know is that certain parts of the brain are affected, with substance use. And so, a lot of times that, the way I like to describe it is, you have the gas and the brakes, right, in your brain. So you have the gas is all impulse, go, go, go. And the brakes is like, don't do that, stupid, not today. That's a bad decision, right? And so even our ability to use gas and brakes appropriately is developmental. So kids, all gas, no brakes, right? We're teaching them how to use their brakes. Their full brain hasn't even developed yet until they're 25. Like that's when the human brain fully develops, right? Around the age of 25. So, most of the time I tell parents who are frustrated with their kids, like, their brain isn't even fully developed yet. Just give it some time, right? And as a parent, I know that that's not always easy to have patience with that developmental stage. Right. So imagine if you hurt your brain by using a substance when you're a child, when you're adolescent, there are some parts of it that might not develop. And some of those might be your impulse control, right? Your ability to use your brakes. So with substance use, it's kind of like your brake line gets cut, right? There are no brakes and it's all gas. So you do impulsive things, you make impulsive decisions, right? Not because you don't know any better, but you can't seem to stop, right? So it's not because you don't know any. So imagine like it's like a switch in your brain that got turned off, right? Because the substance is what turned it off. And no matter how hard you want to turn it back on again, right? It's like you have something in your system that's holding it down, right? And until that thing kind of wears off, you won't be able to, and it has to kind of wear off and have enough time for you to be able to kind of your brain to recover and to rebuild that cognitive functioning back up again. So that's like a simplistic way, a very simplistic, non-scientific way of trying to understand how a person, when they're doing a substance over and over and over and over again for a period of time, how their brain kind of changes and switches where it believes it's the most important thing for their survival. And so it acts as such, right? It acts as such, even though logically you know, they know that that's not, it's that primal part of their brain that kind of kicks in, which is all gas, no brakes. And I think that's frustrating for the individual that's experiencing it, because they say, well, I did know better, you know, but I couldn't feel, I couldn't stop it. And it's very frustrating for family members, because oftentimes they're like, well, I don't understand why you just couldn't stop, right? You know, just don't do it. Just don't pick it up. Just, you know, don't buy it. Don't have it around. So, yeah, I don't know if that answered, is that if that was answering the question that you asked. But that's kind of a way to understand some of the brain changes. And now other schools of thought would say, well, if you take a person and you put them in the right environment, right? And there's a little video called Rat Park. If you want to watch it on YouTube, you could probably find it. But, you know, they did this study where they're like, well, if we have, you know, water that has like something highly addictive, like, you know, opioids or heroin or something in it, and will a rat still go to that water and be attracted and get addicted if we give them all these other things to kind of play with, and we create this little playground for them and change the environment, you know, versus if the only thing in the cage is the you know, the bottle of the drug, well, that's what all they'll go for. So I just want to say that there's lots of other schools of thought around kind of how the addictive process unfolds, but you know, most people who work in the profession would say, but it's not really a choice. You know, it might have started as a choice, but it progressed to something that was impaired choice, right?
So in the church, these are conversations that we can oftentimes neglect and don't have. And for so long, the Bible has been weaponized, and we've used it against people and tell people how they should live and not live and believe and not believe. But knowing better now, how can we show up trauma informed to be able to be a help to others?
Yeah, I think, you know, part for me, part of living out my faith too is just showing up in a way that exudes love and care, right? So, like, when you take away the judgmental kind of finger pointing, finger wagging, you know, you should or else, you know, the you're not a good Christian if, you know, but when you meet a person with true love and care that is always willing to act in their best interest, right? To show up in their best interest. I mean, that's the most attractive part of who Christ was, right? In a lot of ways, is like this love that transcended everything, right? Being able to feel the warmth of that, you know, whether you were whether you just sold him for 30 pieces of silver, or whether you were shunned in any community, you know, just that ability to see people and treat them with love and care, like no matter what, in a way that said, hey, just come be with me, right? That's the only ask, you know. It wasn't if you're cleaned up and if you're this or if you're that, you know, but the ability to kind of love and care in a way that I guess reflects and also leads people to Christ, right? Versus a way that repels them. I think one of the biggest wounds, personally for me as a Christian, is when I hear people say, gosh, you're so you know, that Christians are so judgmental. Like, oh gosh, you know, the last place I would go if I had a heroin addiction was in a church, you know, or the last place I would go, you know, if I was assaulted was to my church because they just blame me for it, or the last place that so that is always incredibly wounding to me, because, you know, wouldn't it be great if that was the first place people went to seek refuge, right? Wouldn't that be more aligned with the kingdom of heaven on earth, right? If folks felt like, you know, that's the first place I'm going to go, because they're going to understand no matter what, you know, they're going to at least try to, or they're going to at least surround me with love and care, no matter what, you know.
uh, what if that I'm pondering, just imagine if that was truly the church. uh, and uh, and I really feel like just a continual theme tonight, Marcelle, is just a challenge for the church to step up, and to even reframe conversation, and to reframe and to acknowledge the trauma and the pain that we all experience, and that we can create spaces where we expect that. I even think about honoring now and just like the wounded healer language, that the way in which, leaders should actually be leading from a place of acknowledging their own woundedness, rather than trying to act like they were perfect or they are perfect. And so imagine what kind of world that we can live in. I would ask, oh, what else would you want to say to us in our church? And anything kind of final as we engage in this conversation. We'll name some kind of potential next steps. But what else would
Sure.
you want to say, Marcelle, just around this topic tonight?
Well, I think, I would want to say thank you for, as a church, having these courageous conversations, right? Because I think just even creating space for the conversation or having it is really, really important. That's kind of step one, acknowledging. But then I would also encourage you to not just have one conversation, right? And so I often will say this at churches that I'm asked to speak at: try to find ways to continue the conversation as a church community. I think I gave you some resources. There's a documentary called The Wisdom of Trauma. Watching that as a church together and having some dialogue or discussion. I'm happy to come back and help lead or facilitate that if you would like, as well. Doing a mental health first aid kind of training as a church group to say, okay, there's some psychological first aid and there's some mental health first aid, just as we learn first aid training, to, help our little ones or loved ones to keep them safe. There's also mental health kind of first aid and learning a little bit more about mental health, taking that conversation a little bit further and deeper. That's another kind of way to kind of extend the conversation. There's a great organization called Someone to Tell It To, and they come into different groups and spaces and really help people develop their skills to be better listeners. And, their whole framework is around if we kind of listen well. But again, listening well, how do we learn how to listen well? I mean, I had parents who didn't listen to me at all, let me tell you, and they live with me now and they still don't listen to me. just a side note. So how do we learn how to listen well? Where are we trained and taught to even do that, right? Some of us might have had horrific experiences with being listened to growing up, and others might have had the most wonderful experiences growing up. So even just learning the art and skill of listening and what types of questions to ask and what to stay away from. I think this is like a community journey. So I would say kind of extending that a little bit and just kind of being more informed. There's, I once heard a civil rights activist speaker say, in this, her name was Minnie Jean Trickey, and she was one of the Little Rock Nine. And one of the things she said is, in this day and age, what information can you not know? Right. And so if you don't know something, it is a choice to remain ignorant. And I thought, I like that. That's a challenge right there. The choice to remain ignorant or the choice to lean in and know more. And so I think when the church kind of cultivates spaces or encourages conversations to continue beyond the one-time event, I think that's really important in the life of a church. So, I have a list of resources of books. I'm happy to put some of the books. There's one that's kind of gained a little bit of traction. It's It Didn't Start With You, is the name of the book. It Didn't Start With You: How Inherited Family Trauma Shapes Who We Are and How We End the Cycle. Folks seem to like that. Another one that gained some popularity that came out is What Happened to You? And that was Oprah Winfrey and Bruce Perry kind of co-authored that. Another one that people seem to like a lot is The Body Keeps a Score. That's kind of a pretty big one in the psychological field. Bessel van der Kolk wrote that one. My Grandmother's Hands is a book that I recommend. It's Racialized Trauma and a Pathway to Mending Our Hearts and Bodies. So this one really does address the issue of police brutality. And it's by Resma Menachem. And then another couple of books, the social justice aspect of kind of poverty and mental health, right? So Matthew Desmond's book, Evicted, Poverty and Profit in the American City, is a great book. And he also just wrote another book, Poverty by America. And so I highly recommend that. And I already mentioned the Unnatural Causes documentary, Is Inequity Making Us Sick? That came out in 2008. And I think the hard thing is how much of it is still relevant, if not even more so in 2023. So I think, that's another one, especially with COVID, one of my, another favorite quote of mine is, we're not all in the same boat. Oftentimes people say, oh, we're all in the same boat. We all experience, nope. Some had yachts, some had rafts, some had, life vests only. And so we're in the same storm, but we're not all in the same boat. And so acknowledging what those differences are, and the resources that some have versus some don't, I think that's an important part of the church kind of starting to name some of the injustices that they can then kind of try to address. Mm-hmm.
Wow. Well, thank you, Marcelle, for all of these books, for tonight's conversation, for your willingness to engage. Something that Marcelle had challenged us to do prior to tonight is, and Marcia Destin, can we make some of those resources? We will do that. I will ask for that list, Marcelle, and
sure.
we can in the chat post this. Thank you for that, Marcia. Is just to challenge us to help this be not a just one-time conversation. So I'm going to put in the chat now, just if someone needs support, if wanting to make available, if someone is needing some support, financial support to engage in therapy or counseling work, or if you want to be part of further conversation, I have reaching out to the Journeys Justice League at brossdavis@thejourneyyhbg.org. That's Brittany, who can help make sure that the conversation continues with the Justice League. And so thank you for helping normalize the conversation, for helping us have the conversation, and for just teaching us along the way. And any concluding thoughts you have, Brittany?
I just want to thank you, Marcelle, for, again, just being open and willing to have this conversation with us. And Pastor Chris, just for continuing to allow us to have a space where we have these conversations and create these spaces of inclusion and, equitability for everyone. So thank you.
Of course. Thank you. Thank you again, Marcelle.
Thank you both so much. I just really appreciate it. I don't know if we got questions from anyone, or if anyone, I'm just going to put my information in the chat, if that's okay, my email that folks can reach me at if you wanted a list of more resources or anything like that. If I can be helpful to you in any way. Did I spell my name right? Yes, I did. If you folks need anything, thank you so much for hosting this. I really do appreciate it when churches have important conversations that benefit their communities in a different way. And so I really do appreciate you taking the time on this Monday evening. And I've so enjoyed spending the time with you all. And I appreciate being invited into your space.
Thank you.
Yes.